let's talk about immigration and healthcare. Would you like me to solve both of them now? Oh, I can do that. But first, let me give you some context. Let's go to the whiteboard. Whiteboard coming at you. Ah. All right, here's what I want to tell you. This is a framework for understanding where I'm going next. Imagine, if you will, that before, and I'm just roughly picking years to make a point, let's say before today, throughout entire human history, mostly we were dealing with shortages, meaning that we were trying to find enough food to eat. We were trying to get enough materials and money and capital, and we were trying to get stuff. We didn't have enough stuff, right? So imagine, let's call that the era of scarcity. But I believe that now our modern systems, from Amazon.com to capitalism to FedEx to all the systems we've built, have created a situation where we can get all the stuff we need if you have a good enough reason to get it. You can find anything you need. You can find a way to get it to you. All you really need is money, and we know how to make money. We know how to make business models. We know how to get jobs. We know how to make money. So I would argue that we are about to enter, or have entered, what I'll call the era of design. The era of design is notable because it imagines that you can get all the stuff you need. You just have to organize it right. Now, in terms of design, I'm talking about systems, not just products. So I'm not talking about designing a new phone. That's just product design. It's not very interesting. I'm talking about designing systems, such as the Constitution of the United States. That's a system. It's a good one. The system of capitalism. It's good. Our legal system. It's a system. All right. And here's my insight. Like every skill, design is something that some few people are really, really good at. Other people are okay at it, and other people are bad at it. It's just like every other skill. The top 1% of 1% of people who are good at this, designing, can change the world. So people like that would be, for example, the founders of this country, who designed a constitution and a system that has been just brilliantly effective for a few hundred years. Now, maybe it won't be always as effective as the environment changes, but they're great. Jefferson and that crowd, Madison, etc., were great designers. So think of them not as founders, think of them as designers of systems. Now, who did we see? Part of the reason I picked 2019 is because of Kanye. So Kanye West. You know the story. On his own initiative, he hired some architectural folks, and they designed some example or test homes that he was trying to develop for low-income housing. When he was done, I guess the neighbors in the city said, hey, you don't have permits, and it's kind of loud, so he tore them down. And I've said that you're seeing the beginning of his design phase, probably not the end of it. That whatever he learned when he built the first ones, now he knows. He'll probably do some more in a different place in a different way, and then he'll keep experimenting and designing his way forward. When you've got people like Kanye designing housing, suddenly you've got something like Thomas Jefferson designing the Constitution. All right, you're elevating the skill level that's going into design. Now, I'm not going to say that Kanye will necessarily design the low-income house of the future and that will change the world, but there are people like him who are that level of creative designers, and you need that level. You need the top 1% of 1% who are getting ready to change the world. Everything's going to be redesigned. Let me give you an example of redesign. And by the way, once we get our systems designed, then we'll enter sort of a golden age where things are going pretty well for us. So let me give you an example of how powerful design is. And I'm going to use an example of a hypothetical deal in which the left and the right make an agreement in which the left gets some stuff they want on healthcare, while the right gets some stuff they want on immigration. This idea, the seed of this idea, comes from Joel Pollak at Breitbart. So credit to Joel for this insight. This insight is that there's something about healthcare and immigration that makes them a natural pair for a deal. And that is that they influence each other. So if you had free healthcare, it would be a problem to also have unlimited immigration, because the immigrants would come in, eventually they would come in at numbers so great that you and I can't afford our healthcare anymore because we're trying to share. All right? There just wouldn't be enough money for you to have healthcare, you if you're, let's say, an American citizen, if you have unlimited immigration. So the two topics are tied necessarily. You couldn't untie them if you wanted. So how could you design a system that takes advantage of the fact that they're connected and gives people what they want? And I'm just going to throw out the bones of an idea. I'm not going to sell this idea as like the best way to go because I don't know, but it'll give you a sense of what I'm talking about in terms of how powerful design is. All right. So imagine if you said the healthcare going forward would be a combination of private insurance, so you could always pay your same private insurance you have, keep it through your employer, and you could have that, and it would be unchanged. But there would also be Medicare for the rest of us with some kind of a needs test, so you can't get it if you're rich, but if you have a certain income, you can just get it. Now, I understand there's something like 15 to 18% of the country doesn't have health care insurance. So you'd be adding to the cost of, I guess you'd be adding to the cost of society 15 or 20% on top of health care. So that would be too expensive. People would complain. But let's say that you simultaneously said, we're going to have private insurance, we're going to have Medicare for the rest of you. That's going to cost more. And the way that we're going to pay for that, at least as an attempt, we'll see how close we can get to this, is to try to reduce costs through competition. The competition specifically would be that the private insurance and the government insurance would be bidding for services and trying to beat down the providers and lower the costs. So you'd have as a goal lowering overall costs of 20%. That would make this sort of revenue neutral country-wise. It doesn't mean every person is revenue neutral, but country-wise, it would break even. And then you would trade this, and again, this is just throwing out the bones of an idea. I'm not saying this is the best idea. You would trade it for effective border security, and you would depersonalize it by saying, whatever the engineers say we should do and where, that's what we'll do. So stop talking about walls, stop talking about fences, stop talking about electronic sensors, stop talking about humans. Just say, here's the deal. We just want the experts to tell us what to do where, not for the purpose of, here's the beauty, not for the purpose of restricting, but for the purpose of controlling, like a lever, creating a system for immigration that when we need more of it, we can easily pull the lever. And when we need less of it, we push the lever. In other words, just creating a system for immigration that we don't have right now. Right now, we don't have a system because it's up to the people crushing the border whether they come in or not. It's not up to us. There are too many of them. We can't control them. So imagine if you could that we agreed that the number of immigrants who would come in on any given year would be based on the unemployment rate. So you completely depersonalize it. And you say to yourself, look, at this unemployment rate, we'll let this many immigrants in. And by the way, Congress, you could make that go up or down. It doesn't have to stay there. We could decide, let's boost that up because it's good for us. And then I'm throwing this in because I think this is coming one way or the other eventually. Someday there will be an app for immigrants who are not citizens who want to work. They connect with employers through the app so that the government can watch everybody do it legally. Effectively, that would mean that having an app would be like a worker's visa without the paperwork. So let me say that again. Instead of going through a legal worker's visa program, if you've got the app and you've signed up for it and it's really you, that's it. You've got a worker's visa. But you also have to have an employer say, I'll give you a job. So the app would be pairing employers and employees. It would be handling the payments so that the government could tax it. How about that? The government could keep track of the workers, and everybody would be legal. Somebody says, you never account for lying, corrupt politicians and officials. Totally unrealistic. Yeah, I'm not saying that any particular plan is realistic. I'm trying to give you an idea of how, if we could design better systems, everything would be better. You know, we don't have a shortage of goods and products. We have a design problem. So I believe that there will be an app at some point that does the job of keeping everybody accounted for, paying their taxes, paired with jobs, maybe even keeping them out of trouble and making it easier for the immigrants to get work, and maybe even making it easier for them to get on some path to citizenship should the country decide that they want to do that. All right, so here's what it would look like as a designed plan. Now, you could call this a deal. If you're talking in President Trump language, you'd call it making a deal. But it's a special deal because it would have to be designed so that these two parts of the deal work together. So that if unemployment starts to go up, you don't have to build a wall then. What would be the worst system? Here's the worst system. Would be unemployment starts to go up in this country, and then we can't stop people from coming in. That would be the worst system, right? The best system would be if we get a lever and our unemployment goes up, and then we just pull back a little bit on immigration. Not completely, just pull back enough to get our employment back where we want it. And again, those things could be negotiated by Congress. It doesn't have to be what the president is forcing on the country. Somebody says, are you saying automation will have no effect? No, I'm not saying anything like that. Somebody says, how about a better system instead to train and educate people born and raised here first? Well, those don't have to be insteads. Those can be in addition to's. So why wouldn't we do both? Okay, so the other thing I wanted to point out is that I think Kamala Harris has some kind of a plan where at least for 10 years you get to keep your private insurance. But I'm waiting to see the good argument against having dual healthcare systems, because I don't know any good argument against that. Do you? Does anybody have a good argument for why we wouldn't just have dual healthcare system, cover everybody, but with a an income test? Well, dual healthcare with everybody covered. That's the part that's different. All right. Somebody says Germany has dual healthcare system and it works well. Yeah, I think there are a few countries, in Great Britain is the other one, right? Where they can do that. Now, the real question is whether any of this allows you to lower costs. And it seems to me that the administration could make a deal with the Democrats to say, if you will help us do these market-based things to lower costs that will drive down costs, help us with the votes we need to drive down costs, we'll help you get a system that runs parallel with private insurance so that everybody can get health insurance. I feel like that would be a decent deal. But it has to be tied to immigration. You absolutely can't have a free healthcare system and open immigration. I think everybody understands that. They just need to hear it. It's one of those things that just needs to be said, and then you hear it the first time, you go, oh yeah, that's true. How many people do you think in the voting public know to make the connection between immigration rates and what we can and cannot do in a practical sense with healthcare for all? Do you think most of the public just sort of immediately connects those two and says, oh, I want healthcare for all. Oh, wait, I can't have that if it's also open borders. I don't know that everybody makes that connection. And once you make that connection, this design just falls out from that, doesn't it? It just sort of, blah. It's the obvious thing where you end up. Now, I keep saying that I think healthcare is going to end up with some kind of a dual system. But I'm really kind of testing that idea because I keep expecting that someone in the comments or somewhere else will say, Scott, read this article or look at these statistics, and you can see why you can't ever have a dual healthcare system. It won't work, and here's the reason. I haven't seen a reason. I mean, I'm not saying I've seen bad reasons or any reasons. Have you? All right. Explain the difference between outcomes. Why would I keep private? Oh, so you would, the only people who could get the public option under the dual system I'm talking about would be people who were below a certain income or over a certain age, or I think below a certain age. So children and seniors and then adults under a certain income would be the only ones who could get the government to pay for it. Everybody else has to pay for their own because they have money or they have a job and their employer is paying for it. Then the second thing is the quality of the care. A lot of people have a preference. You might not be able to get the same doctor, the same quality of care, the same timeliness, the same confidence as if you are in a private option. Somebody says, in Germany, anyone can get the public system, but above a certain income. Yeah, so it's so the other way to do it, which is effectively the same thing, is that your income determines what, if anything, you would pay for the public or private options. All right. Will it be mandatory to have one or the other? I don't see why it would be. Why would you force somebody to have mandatory free insurance? You can't force somebody to go to the doctor. So, for the free option, the one that's below a certain income, people can just ignore it. But I suppose all you'd have to do is show up to the right kind of doctor or emergency room and you'd be covered. I think that's what it is. Now, somebody's saying, what if you have money, but you don't want to buy private insurance? Well, I guess, I don't know, we'll deal with that somehow. Okay, how many people think I just solved climate change? Not by myself, obviously. Healthcare and immigration, again, not by myself. I'm using Joel Pollak's seed of an idea and expanding on it. So don't blame him for anything I expanded on, just the insight that those two things could be a deal because they both. So here's the other reason that healthcare and immigration make a natural deal, because they're equivalent emotionally, right? They're sort of both large national interests that have our emotions and our attention. And if I said to you, what's bigger, immigration or healthcare? Well, you'd have to think about it for a moment. You'd probably say healthcare. Some people would say immigration. So the fact that you'd have to think about it tells you they're both big. And that makes it a fair trade. It's like, okay, I'll give you your big thing. You give me your big thing. And we'll both make the thing we're giving up at least a little bit moderate. So, this is the quietest I've ever seen my audience. I don't know what's going on here. Is there anybody who thinks this is a bad idea? Did I just describe solutions for the three biggest problems in the world? No, that's not true. The three biggest, let's say, political topics in the country. Did I just describe three solutions for the three biggest political issues? And everybody here is going, oh, okay. Is that what happened? I don't know. So some of you are saying no and not solved, but I'm not seeing any reasons. Is there something obvious I'm missing?